Well, thank you very much, and good morning, everyone. Thank you so much for being here. My name is Jenny Kwan. I'm the Member of Parliament for Vancouver East and the NDP critic for Immigration, Refugee and Citizenship. We're going to go into the speakers, but before I entered into comments, I'm going to actually ask Dr. Badi to introduce all the guests that are with us today and those who are joining us virtually.
Is that working? Yeah. Okay. Good morning. My name is Manal Badi. I'm a family physician providing care for refugees and newcomers to Canada. We're here today representing frontline healthcare workers to speak about the devastating health impacts of the federal government's decision to cut essential health services for refugees. Bonjour, je m'appelle Manal Badi, je suis médecin de famille et je soigne les réfugiés et les nouveaux arrivants au Canada. Nous sommes ici aujourd'hui pour représenter les travailleurs de la santé en première ligne et aborder les conséquences dévastatrices sur la santé de cette décision du gouvernement fédéral de réduire les services de santé essentiels pour les réfugiés. Established in 1957, the Interim Federal Health Program provides temporary health coverage for refugees and asylum seekers. As of May 1st, 2026, refugees will be responsible for a $4 copay for each prescription and a 30% co-payment when using essential care services such as emergency dental care, mental health counseling, and assistive devices. Créé en 1957, le Programme fédéral de santé intérimaire offre une couverture santé temporaire aux réfugiés et aux demandeurs d'asile. À compter du 1er mai 2026, les réfugiés devront payer un copaiement de $4 pour chaque médicament prescrit sur ordonnance et un copaiement de 30% pour les services de soins essentiels comme les soins dentaires d'urgence, le soin psychologique et les appareils fonctionnels. We are representing a few of the more than 43 national health organizations that have officially denounced these cuts. Nous représentons quelques-unes des plus de 43 organismes nationaux de la santé qui ont officiellement dénoncé ces coupes budgétaires. Today, you will hear from our representatives who will speak to the direct and harmful consequences these cuts will have not only on refugees, but on all Canadians. Our message is clear and unified. These cuts are inhumane, economically unwise, increase healthcare costs, and create insurmountable barriers to care and integration for one of the most vulnerable people in our communities. We are calling on the government to reverse these cuts. Aujourd'hui, vous serez à l'écoute de nos représentants qui aborderont les conséquences directes et néfastes que ces coupes auront non seulement sur les réfugiés, mais aussi sur tous les Canadiens. Notre message est clair et unifié. Ces coupes sont inhumaines, économiquement irresponsables, augmentent les coûts de soins de santé et créent des obstacles insurmontables à l'accès aux soins et à l'intégration pour l'un des groupes les plus vulnérables de nos communautés. Nous demandons au gouvernement de revenir sur ces coupes. I will now introduce our next speakers in this order. Dr. Vanessa Reddit, family physician and founding steering committee member of the Canadian Refugee Health Network. Dr. Charles Hui, pediatric infectious diseases specialist, chair of the Canadian Pediatric Society's Caring for Kids New to Canada. Dr. Edward Chie, emergency physician, director of the Board of Canadian Doctors for Medicare. Ilda Azzam, registered social worker representing the Canadian Muslim Healthcare Network. Dr. Nazila Bettache, internal medicine physician and assistant professor of medicine, representing Caring for Social Justice Collective. And now I head it over to our first speaker, Dr. Vanessa Reddit.
Thank you. My name is Vanessa Reddit, and I'm an academic family physician, educator, and researcher at the University of Toronto. I am a founding steering committee member of the Canadian Refugee Health Network, an association of physicians and healthcare providers with extensive frontline experience caring for refugees and claimants across Canada. I have dedicated my career to the care of refugees, claimants, and migrants. I'm here representing physicians and healthcare providers across the country to express my profound concern for the immediate harm refugees will suffer due to the cuts to the Interim Federal Health Program. I am calling on the government to rescind this cruel and costly decision. The IFHP exists to provide critical care to refugees and claimants at a time of transition as they're escaping from war, torture, sexual violence, and persecution, and are trying to rebuild their lives in Canada. They rely on IFHP for access to necessary healthcare services and treatment, including medications, therapy, and medical devices. To call these services supplemental is inaccurate. For those with medical needs, these services are life-sustaining and essential, not optional. Every day, I have patients who cannot attend their medical appointments because they don't have the $3 for the bus fare, or who are eating one meal a day because that's all the food they can afford. The IFHP health benefits are aligned with those afforded to individuals on social assistance and low-income seniors at a similar low-income level. These new co-payments are completely unaffordable to most refugees who live in poverty in the first year or years after arrival. These co-payments are thus a denial of care. We know that even seemingly small copays result in barriers to care and poor health outcomes, particularly for low-income individuals. When people cannot afford medical services, they delay or forego necessary care, leading to crises that overwhelm our already strained emergency department and hospitals. What could have been prevented ends up as catastrophic for individuals and families, all while costing our system more. Consider a single mother on multiple medications for high blood pressure and diabetes. Faced with an unaffordable copay for her prescriptions, she feeds her children instead, who wouldn't. Without her medications, she has a stroke and ends up with a prolonged hospitalization, costing an average $10,000 for a stroke hospitalization. She endures persistent neurologic deficits that prevent her from entering the workforce. The cuts to IFHP have condemned her to prolonged disability, lost workforce participation, and a cycle of poverty, all while costing the system more. As a family physician and health policy expert, I intimately understand how timely, comprehensive primary care, including preventative and rehabilitative care treatment, pays dividends in better health outcomes, lower health system costs, less disability, and greater participation in the workforce and community. Early investment in refugees' health helps them get back on their feet faster. A basic tenet of effective healthcare delivery is to ensure that we provide the right care at the right time in the right place. This means a child with tonsillitis receives timely antibiotics from their primary care provider in the community, avoiding the progression to a peritonsillar abscess requiring hospitalization. This means a survivor of sexual violence receives timely and appropriate trauma counseling, avoiding a mental health crisis that lands them in the ER or a psychiatric department. Make no mistake, cuts to IFHP are not transferring money to health budgets or other social services for Canadians. The introduction of copays for refugees signals a deeply concerning erosion of our universal health care system. And let me remind you that we have been here before in 2012 when the Harper Conservative government made significant cuts to the IFHP. Healthcare workers and community members mobilized across the country and took the federal government to court. The federal court ruled in favor of refugees and stated that the cuts amounted to cruel and unusual treatment and were a violation of the Charter of Rights and Freedoms. Rather than punching down and punishing those already facing oppression and marginalization, we need to collectively work towards uplifting healthcare and rights for all. This is about the society we want to live in and that we want to build for our children and future generations. I'm calling on the government to immediately reverse the cuts and to reinstate the Interim Federal Health Program in its full capacity. Thank you.
And now we will hear from Dr. Charles Hui, pediatric infectious disease specialist and chair of the Canadian Pediatric Society's Caring for Kids New to Canada.
Thank you. My name is Dr. Charles Hui. I'm a pediatrician, an infectious disease physician, and an academic. I'm the chair of the Caring for Kids New to Canada Task Force of the Canadian Pediatric Society. The Canadian Pediatric Society has joined over 40 other healthcare organizations in writing Minister Diab, expressing our grave concerns about the IFHP changes. No child chooses to be a refugee. Many refugee children and youth have been exposed to conflict and are living with medical conditions that have been inadequately treated. The proposed changes to the IFHP program creates additional barriers to these essential services for vulnerable populations. As pediatricians, we know that delays in diagnosing or treating medical issues can have long-lasting effects on a child's health and development. Reduced access to care within the community will likely mean that more children and youth only receive medical attention once their conditions have progressed to more advanced and avoidable situations. This, in turn, will result in more avoidable hospitalizations, greater pressure on pediatric services, and higher costs to the health system overall. While refugee children and youth are at risk, there's a small but significant group whose health needs are particularly complex. Some depend on specialized medical equipment, such as feeding pumps, medically implanted devices, or wheelchairs, simply to survive. The proposed IFHP changes would require families to cover costs for this essential equipment amounting to thousands of dollars, funds which most refugee families simply do not have. Without access to this equipment, these children will face severe health complications, diminished quality of life, and even reduced life expectancy. As an infectious disease physician, I'm especially concerned about any measures that deter or impede access to health care. Timely prevention and treatment of infectious diseases not only protects individual patients, but also reduces the risk of transmission within the broader community. Canada is a signatory to the United Nations Convention on the Rights of the Child. As healthcare providers, we're obligated to uphold the principles of this convention. The proposed IFHP changes stand in opposition to Article 24, which recognizes the right of the child to the enjoyment of the highest attainable standard of health and to facilities for the treatment of illness and rehabilitation of health. The introduction of IFHP co-payments will lead to real risk of irreversible harm to children, youth, and their families. It will increase healthcare costs and increase strain to the healthcare system already overburdened. We implore the government to reverse these changes and strengthen Canada's commitment to ensuring universal healthcare for all.
Thank you, Dr. Hui. Now you will hear from Dr. Edward Chie, emergency physician, director of the Board of Canadian Doctors for Medicare.
Good morning, everyone. Bonjour à toutes et à tous. My name is Edward Chie. I work as an emergency doctor and a director on the Board of Canadian Doctors for Medicare. We're a national organization of physicians dedicated to evidence-based analysis and solutions to strengthen our publicly funded healthcare system for all. We're deeply concerned about the planned cuts to refugee healthcare and the introduction of co-payments precisely because of what the Canadian and international evidence tells us. Out-of-pocket patient fees increase the already high barriers to care for marginalized groups, and financial barriers are likely to result in worse health and social outcomes for individuals and their families. For people who've been forced to flee their homes, leave behind support networks, and often endure severe financial hardship, $4 for every prescription and a 30% fee for essential therapies and devices may be impossible to come up with while people are just getting on their feet in Canada. The Interim Federal Health Program offers time-limited health insurance to refugees, claimants, and people who've been trafficked during a time when they are typically not eligible for other coverage. This transitional period coincides with higher needs, including for chronic conditions, trauma-related mental illness, and months or years of inadequate care. But despite this need, program spending per beneficiary is less than a third of publicly funded health spending per person for the general population. That's a wise investment for the future because unaffordable care can have system-wide side effects. In the ER, my colleagues and I witness how lack of access to medications and therapies lead to disease progression, health complications, disability, and costly and unnecessary hospitalizations. ICU admissions for diabetic comas when people run out of insulin, painful chronic jaw infections because of unaffordable dental care. When people can't afford essential care, it leads to a revolving door of inadequate but costly emergency services. A lose-lose scenario for all of us. What's needed are medications, assistive devices, and therapies early and in the community. Evidence-informed policies that benefit the health of everyone, prioritize primary and preventive care, eliminate barriers for marginalized people and those with higher need, and focus on strategies to prevent the unnecessary use of expensive and frankly stretched thin emergency departments and hospitals. Trust me, we don't need the business. Canadian Doctors for Medicare joins national organizations, including the Canadian Nurses Association, Canadian Dental Association, Canadian Association of Emergency Physicians, and dozens of others, in asking the federal government to do what is evidence-based, responsible, and appropriate based on need. Reverse the cuts to the Refugee Health Program, remove all co-payments, and reinstate full coverage. We need leadership to make the right decision before patients are put at risk. Thank you. Merci.
Thank you, Dr. Shia. Now we will hear from Ilda Azzam, registered social worker representing the Canadian Muslim Healthcare Network.
Apologies, I was muted. On behalf of the Canadian Muslim Healthcare Network, I speak today not only as a registered social worker, but as someone who sits every day with people living through the aftermath of war, displacement, persecution, and the loss of everything they once called home. The refugees and claimants I work with carry an immense burden, surviving trauma while navigating unfamiliar systems, securing housing, feeding their children, and enduring ongoing uncertainty. From a mental health perspective, imposing new costs through cuts to the Interim Federal Health Program does not reduce need. It blocks access to essential care, disrupts continuity, and delays treatment until symptoms escalate into crisis. The result is predictable, greater distress, more acute presentations, and increased reliance on already strained emergency systems, compounding preventable harm at every stage. Today, two separate but converging policy changes are deepening that harm. The first is Bill C-12, which tightens the legal pathways and protections available to refugee claimants. For people who have already fled persecution, the added uncertainty around their status and their future in Canada is not a bureaucratic detail. It is a re-traumatization of daily life. The second is the proposed changes to the Interim Federal Health Program. As of May 1st, 2026, Interim Federal Health beneficiaries will be charged $4 per prescription and 30% of the cost eligible supplemental services, including counseling. Providers across Canada are clear. These co-payments are not a minor adjustment. They are a barrier to care. Together, these policies hit the same people at the same time. One destabilizes their sense of safety. The other cuts them off from the care that helps them survive it. Let me tell you what this looks like in practice. I think of a young man from Myanmar who fled after his village was burned and his father killed for being Muslim. He already arrived here carrying the weight of religious persecution, the grief of leaving behind a mother and siblings still living in a displacement camp, and the constant fear of being sent back. Therapy is the one space where he can begin to breathe. A 30% copayment would quietly push that space out of reach. I think of a mother from Gaza, a widow raising 3 children, one of them living with a disability. She has lost her home, her husband, and much of her family. She sits across from me describing nightmares she cannot stop while budgeting every dollar for rent, food, and her daughter's medication. For her, $4 per prescription is not a small fee. It is a choice between her child's inhaler and dinner. I think of a woman from Uganda, a survivor of sexual violence, who finally trusted a counselor enough to speak her story aloud. Asking her to pay out of pocket is asking her to decide whether healing is something she can afford. These are not abstract cases. They are people whose identities as women, as racialized, as disabled, as parents, as survivors intersect in ways that compound both their trauma and the obstacles they face. As the Canadian Association of Social Workers has warned, co-payments delay access to preventative care and increase long-term health system costs when treatable conditions become emergencies. We are calling on Parliament to reconsider Bill C-12 to reverse the proposed co-payments under the IFHP and to meaningfully engage the healthcare providers and communities who understand what is at stake. Because when care is accessible, people stabilize. When people stabilize, families heal. And when families heal, communities grow stronger. That is what a healthcare system is meant to do. And that is what these policies are putting at risk. Thank you.
Thank you, Ilda. Now you will hear from Dr. Nazila Bettache, internal medicine physician and assistant professor of medicine, representing Caring for Social Justice Collective.
Bonjour tout le monde, je m'appelle Nazila Bettache, je suis médecin interniste et je suis membre du collectif Soignons la justice sociale. Nous sommes indignés par les coupures annoncées au programme fédéral de santé intérimaire qui, comme des dizaines d'organisations majeures en santé l'ont dénoncé, se font au détriment de communautés déjà marginalisées, au coût de leur santé et de leur dignité, comme l'ont exposé mes collègues, mais aussi au prix de notre humanité collective. Ces coupures sont contre-productives, elles sont hypocrites, elles sont injustes et elles sont violentes. Contre-productives, car elles ne sont en aucun cas une mesure d'économie. Elles vont à l'encontre du principe d'universalité des soins, au lieu de permettre aux demandeurs d'asile et réfugiés de trouver la sécurité et la dignité dont ils et elles ont besoin, elles contribuent à plus de précarisation. Hypocrites, car elles ignorent le système d'apartheid mondial qui force le déplacement des réfugiés. Un système où les industries minières et fossiles canadiennes, où les politiques du Canada jouent un rôle majeur ailleurs, de la Palestine au Soudan, en passant par Haïti, tout en continuant la dépossession des peuples autochtones et la spoliation de leur territoire ici. Injuste, car au lieu d'assumer la responsabilité de décennies de désinvestissement des services publics, elle jette le blâme sur des communautés migrantes déjà précarisées comme boucs émissaires, à coup d'une rhétorique déshumanisante qui divise pour mieux régner. Et elles sont violentes, car elles infligent une souffrance évitable et indue à des personnes qui sont nos patients, mais aussi nos collègues et des membres de nos communautés. En fin de compte, nous savons que la décision de couper le PFSI est un choix politique et non une nécessité financière. En tant que soignants et soignantes, nous ne pouvons pas rester les bras croisés alors que nos gouvernements justifient leurs attaques contre les personnes les plus marginalisées à travers un discours d'austérité qui présente les soins de santé comme un privilège réservé à une minorité et dépeint les migrants comme des boucs émissaires. Au lieu des milliards dépensés pour les économies de la guerre et les énergies fossiles, un système de santé publique véritablement universel pour tous et toutes, sans égard au statut migratoire ou à la capacité de payer, contribuerait à bâtir l'économie du soin et de la solidarité dont nous avons cruellement besoin. Cela impliquerait l'élargissement du panier de services pour inclure des soins dentaires, des médicaments, autres thérapies, etc. Au lieu de l'idée pernicieuse selon laquelle certains ne méritent pas de vivre dans la dignité et la santé, nous, comme soignants aujourd'hui, unissons nos voix avec plus d'une quarantaine d'organisations nationales de la santé pour refuser d'ériger des frontières au sein du système de santé. Au collectif Soignons la justice sociale, nous exigeons l'annulation immédiate des coupures au PFSI, l'accès aux soins de santé universels pour tous et toutes, et un programme de régularisation complet, inclusif et permanent. Ces mesures sont non seulement possibles, mais elles sont de plus en plus nécessaires alors que les crises se multiplient. Tout ce qu'elles requièrent, c'est la volonté politique de miser sur une réelle équité et une solidarité véritable. Merci.
Merci. Thank you very much to all of the speakers. I'm here today to join with them in their call for action, to say to Prime Minister Carney that the change that's coming on May 1st, where the Liberal government would impose a co-payment requirement for the Interim Federal Health Program for refugees and its implications. As we've heard from all the speakers, a $4 requirement for prescription is prohibitive for many of the refugees. A 30% requirement of co-payment for services like vision care, like dental care, like mental health support, counseling support, like equipment, medical equipment that are in fact necessary and essential for the health of the individual is prohibitive. What the government is doing is penny wise, pound foolish. What the government is doing is something that has been tried before. In fact, under the Harper government, they imposed a fee and reduced services, and the courts actually ruled it to be unconstitutional. We have been down this path before, and we should not go there. So Canada is a signatory to the UN Convention. We made a promise, not only in Canada, but to the international community, that we will support refugees. And now that they're here, what the government is doing, bit by bit, is eroding their support. And let us be clear, a co-payment that is required for mobility aid, for dental care, for vision care, for mental health support, it is not a small inconvenience. What it is that it is prohibitive. And in actuality, what this amounts to is a denial of care. Now, I can tell you this. When my family arrived here many, many decades ago as new immigrants, I was a young girl, and we lived in poverty. We did not have a lot of resources. We were a family of 8. My mother worked as a farm worker, making $10 a day to support a family of 8, while my dad went to get English as a second language support. He was trained as a tailor by trade, but he could not get work here until he had some language capacity. My mother was a homemaker where we came from, and she entered into the workforce for the first time, making $10 a day. There were many, many days, I got to tell you, that I watched my parents who did not eat because there wasn't enough food on the table. They will say to the children, to the 6 of us, that they weren't hungry. And boy, oh boy, when we got sick, having to buy medication, having to pay because we did not have insurance, having to pay that amount meant many, many days where they went without food. That is a reality. It is not a dreamed up thing. It's not a made up thing. Many of us who grew up in that environment lived it. Now, refugees who come to Canada, just imagine who they are and think it through. These are individuals who fled persecution, whose lives are in danger, and they came to Canada for safety. These are individuals who fled conflicts and war zones because their lives are in danger. Some of them have lost loved ones. Some of them suffer injuries. For women, particularly, and we know this to be true, women experience sexual violence because too often sexual violence is used as a weapon of war. Imagine if you suffered any of those kinds of trauma, what it would be like when you're here in Canada, finally in a place of safety, and you can't barely survive. You can't seek the medical help because you can't afford it. And even if you go through the process of building that trust, having to pay 30% for trauma-informed support is prohibitive. These are not luxury services. These are essential healthcare services. As a parliamentarian, this is something that New Democrats have been fighting for, head-to-toe care for everyone. That's what we're fighting for, and here we are. Under the Carney government, they somehow think that it is okay to erode those services for refugees, for people who are some of the most vulnerable people in this country. And I'm here to say that it is wrong. In this context, people will say that, oh, but Canada can't afford it. We can't afford it. We all have to sort of cut back. Well, just think about this for 1 minute. The oil companies, right now, in the illegal war that has been waged by Donald Trump in Iran, means that the oil companies will have windfall profits of some $90 billion. Just in this period, $90 billion. Just let that number sink in for a minute. And yet the Carney government refuses to bring in a windfall profit tax for these big corporations that are raking in, that are gouging Canadians at the pumps. I won't go on about grocery giants as well, but you can imagine the billions of dollars that they're making in windfall profits. At a time when everyone else is struggling with the cost of living, instead of really addressing the issue and saying that these companies, these oil companies, these grocery giants that are raking in billions of dollars in excessive profits, the government is refusing to say they need to pay a little bit more. But instead, they're going after refugees to say they need to pay a little bit more for health care that they absolutely depend on. It is immoral, it is wrong, and New Democrats are here to support the refugee community, the healthcare professional, the support services in our community, to call for the government to do what is right and to reinstate full support for the Interim Federal Health Program. Thank you.
Thank you. We'll now move on to questions. We have one question in the room, and then we'll move to Zoom. Sarah Harb from the Hill Times, please go ahead.
Thank you to all the speakers for your insights. I have a question for you, Jenny Kwan, regarding a press conference that you did last week on biometrics and students in Gaza. So at the press conference last week, you and PSAR colleagues called for expediting processing and biometrics flexibility for students in Gaza. The IRCC has stated that it's committed to a fair and non-discriminatory procedure, but that they don't operate in Gaza. Is the biggest obstacle biometrics, or is it the way that these applications are being handled together, especially in cases where students have already fled to Egypt and Jordan? And have you heard anything from the Minister Diab, or any other cabinet ministers?
Well, thank you very much for that question. With respect to the barriers for students to come to Canada, biometrics is one of the barriers that they face. As we know, the students who have not had biometrics done previously are unable to have their biometrics completed because there are no biometric centers available for them to access that service. However, what we have seen is that other countries have found workarounds, different abilities to get that security measure addressed. Take, for example, Ireland, the UK, other countries have found a way, and they managed to have that issue addressed within 2 weeks. And Canada, by the way, have done this before with workarounds with biometrics. And in some cases, even biometrics has been waived by certain populations. So why is it that the Canadian government cannot adopt those kinds of measures that have been done before? And so some might say that it's an excuse for the government to say that they can't address the issue. And I would argue that it is. Some might argue that is Palestinian racism, that the government is refusing to adopt measures to facilitate a process that is safe and secure for Canada. So that's one piece with the biometrics. There's another piece as well, though, outside of biometrics, because there's some students whose biometrics has been completed, but still the government would not finish processing their application. They're just stuck in limbo for almost 2 years now without a decision. What do you call that? There is no excuse for the government to say, sorry, we can't finish your application in processing because of the biometrics issue, because their biometrics has already been done. What exactly is the rationale? So the government then for some of these applicants have come up with additional requirements for security screening, even though they've had their biometrics done. We even have students, by the way, who came to Canada before, previously, and did extensive work in their studies, in research, contributing to the Canadian economy, to our academic community. They have been approved and came and left without incident. They are now coming back to do a PhD, and still the government would not process those applications. So here we are. This is the situation. And I like to ask the minister, who, by the way, has not responded to the issues that I brought to her attention. And I like to ask the minister, what exactly is your justification for your inaction? Because that inaction effectively results in a denial. And that's why some students are in fact taking the government to court. And it shouldn't be this way.
Thank you.
Sarah, do you have a follow-up?
No.
You're good? Okay. We have one person on Zoom. If you'd like to ask a question, please use the raise hand function. I'll ask a question. I forgot to introduce myself. Najida Melis from Bloomberg News. A few of you mentioned that this move undermines the universality of healthcare in Canada, but Canadians, as you know, don't have government access to coverage for prescription drugs. They don't have that for vision care. They don't have that for dental care. And they don't even have that for mobility devices. In Ontario, the ADP only covers 75%, and then Ontarians pay 25%. So I'm sure you're aware that individuals, critics, or those who want to see these cuts would say, well, Canadians don't have access to this. Why should this program provide that for refugees? I'm just giving you a chance to respond to that.
Perhaps I'll jump in.
Sorry. Yes.
I can take that question. So the health benefits that are covered under the Interim Federal Health Program for refugees are aligned with those that are afforded to individuals who are on social assistance and low-income seniors who are at a similar low-income level. So we've already established a principle of equity where we recognize that individuals who face financial barriers should receive additional assistance so that they can receive these essential healthcare services. That's number one. Number two, we are seeing a positive movement, and the evidence supports this, to bring in more universal access to services. This is what the Canada Dental Care Plan represents. There is recognition that people should not face financial barriers to receiving essential dental care. And it is actually much more comprehensive in the benefits that it affords compared to the emergency dental covered under IFHP. We have movements towards a universal pharmacare program that is necessary. Canada actually lags behind many other countries that do not many other countries that do cover medications and treatment. I can say more, but I'm going to hand over to my colleagues. Dr. Bettache.
Thank you for the question. If I may add, this is the very basis of a universal public healthcare system that we've been advocating for decades. As you know, in Canada, people fought hard in the 1960s and 70s to have a universal healthcare system that's now being taken apart bit by bit. And so the idea of people being able to access universal healthcare is one that we're advocating for everybody. That includes pharmacare, that includes dental care, that includes physical therapy, that includes mental health support. We're in a context where there is a rising privatization of healthcare system across the country. As you know, there's Bill 11 that was recently passed in Alberta that opens the door to the private industry. There's a deep attempt at eroding a public healthcare system, and I would argue this is an opportunity to fight back and to push for a truly public universal system for all, regardless of migration status, regardless of ability to pay. This is an important struggle that's been ongoing for decades, and it's not an opportunity to continue to push for that in this moment.
I'll just quickly echo my colleagues. First, there's nothing so frustrating as feeling like other people are getting an unfair leg up. But applied to the Refugee Health Program, this is a well-worn distortion of the facts. The reality is that the coverage provided by the health program is very similar to what people with lower income or higher needs get in provinces and territories across Canada. And because refugees come from such dire situations, the treatments and rehab covered by IFHP are in practice essential to restoring health so people can learn, work, and care for others. The second point I'll make, and this is a key one, I'm going to echo what my colleagues just mentioned, is if your child or parent didn't have health insurance to cover the care they need, you wouldn't say, well, their neighbors don't have health insurance either, so why should my family get those benefits? Of course not. How did we get a national public Medicare system in the first place? It's because people looked around their communities, saw that folks were getting sick because they couldn't afford care, and people fought for a system that was more comprehensive, better managed, and more fair than what we had. We all recognize there's still lots of gaps, which is why we need to keep upgrading it for everyone instead of taking care away from those who need it most. Thanks.
Oh, I don't see any more. No, okay. I don't see any more questions, so that concludes our press conference. Thank you very much.
Okay, thank you very much, everyone. I just want to also thank and acknowledge the people on Zoom. Really appreciate you joining us virtually. Thank you, everyone.